Hey guys, welcome back to Nursing with Naomi. It's Naomi and I'm here at work and I wanted to show you quickly this IV situation and how to reconstitute it into this bag. So here it goes. Okay, so this comes like this. This is an antibiotic and it comes in a powdered form. And then this is just normal saline, a little baggie. So what you do is you're going to pop the top off of this, and as long as you don't touch it, it's still sterile. This, you're going to pull the tab down, and it reveals the little puncture device. So you're going to take it, and you just insert it. You got to kind of push hard. Okay. Then what you're going to do, this blue thing right here, see that? You're going to break that, okay? And it opens it up a little bit. You squirt in some of the saline. Can you see that? Then you gently swirl it around. Okay. The first time I saw these, I was like, what the crap? How am I supposed to use this? So you just want to swirl it, make sure it all gets dissolved. You can see it's all dissolved there. So now you're going to turn it upside down, squeeze. You're squeezing air into it and it draws the liquid back in. And you just do that until all of the mixture has gone back in. And it doesn't go back into the bottle. So you go ahead and prime it per usual and run it. So that is how you reconstitute a medication into the IV bag like this. So hope that was helpful and hope y'all have a great day.